doing some incredible things at LDS Hospital right now when it comes to mobility, like that knee that just isn't moving like you wish it would, those hips that are hurting all the time. We met two women that what they're doing there, it absolutely changed their life. Take a look. We're sitting at the Joint Replacement Center at LDS Hospital, and I'm with Dr. Gililland and two of his patients, Faith and Jane. And ladies, could the two of you do something for me right now that they literally could not do 6 months ago without pain? What is it?
Stand up.
That's it. Faith, you could not do that without pain 6 months ago?
No, I couldn't.
What does it feel like now?
It feels great.
Okay, have a seat, ladies. Dr. Gililland, they both had some joints replaced. Can you tell me a little bit about your patients here?
Yeah. Well, Faith here had bilateral hips that were very, very arthritic. She's a very young and vibrant woman, and walked in the clinic with quite an abnormal gait due to her pain. Both hips were really bad, and she had some significant goals that she wanted to meet. She wanted to get to her daughter's college graduation and walk smoothly without having pain. Jane, on the other hand, had bilateral knees that were both quite arthritic. Her left side was much worse than the right, and she decided to move forward with getting the left side replaced in order to walk smoothly. How
common is that procedure, either procedure?
It's actually more common than you think. I mean, I think patients feel like they're on an island if they come in with arthritis, but knee and hip arthritis is extraordinarily common in this country. We have hundreds of thousands of total hip and total knee replacements done on an annual basis, here in the United States.
Jane, I'm thinking a lot of people put it off because you're worried you're going to be immobile. Did you put it off for a couple years?
A long time.
Really?
Probably 10 years ago, I had a doctor, when we still lived in Iowa, tell me that I would need that knee replaced, and I ignored it, and I thought, I'll deal with the pain, And I had stepped off of a curb. I had some packages in my hand. I stepped off the curb, and it was just like I tore that knee, and it hurt so bad. I sat with ice on it for 4 days. Finally, then I went to my doctor, and she recommended seeing an orthopedic type surgeon. And so down the chain, I ended up with Dr. Gililland, and I feel like a brand new person. It's absolutely wonderful now.
Dr. Gililland, is this getting easier to do, and the recovery's easier and easier?
We're certainly improving our techniques as time goes on. We're improving our pain management protocols significantly, and it's definitely easier on patients. I mean, I think our stays are shortening, our discharge to home is improving, where we're having less patients go to skilled nursing facilities and rehabs.
What about what goes into the knee and what goes into the hip? Has that changed?
Yeah, our components are definitely improving. The plastics that we use as our bearing surfaces is improving on a constant basis, and we're hoping that we can get decades out of these implants we put in people and get as much longevity and life out of them as possible.
Faith, how long did you think about doing this before you did it?
I wasn't really even thinking of doing it. I put it off for quite a while, and I was thinking maybe I would go into the doctor after my daughter graduated and after we sent her off to college. But then during the holidays, I was pretty immobile, and that's when I started thinking about it. So it was a long time.
And what was the procedure like for you?
I had the worst thought in mind, so it actually was a lot better than I thought it would be.
When you say double hip replacement, and you had the first one in January and the second one in March, and here you are sitting with us right now, did you think you'd be this far along?
No, I didn't think I would be.
Will you be able to walk at your daughter's graduation?
Yes. I'm already walking.
But patients can do that after these procedures now.
Absolutely, yeah, absolutely. I mean, we hope to get people back to, the vast majority of their activities. I tell people the only thing I don't want them to do is become a long-distance runner, but short of that, I let them do whatever they feel like they'd like to do.
Well, you're making people happy. You have a great job. Two satisfied customers.
Yeah, it's a fantastic job, and it's great to work with people like these guys, and I have the best job in the world, I feel like.
LDS Joint Replacement Center here at the hospital, ldshospital.org, for all the information. If this is something you've been thinking about, you've been putting off, please go to our website, goodforutah.com/GTU, and we'll link you to all the information. Thank you so much, you guys. Do you see the smiles on those women's faces? I mean, both of them had surgery within the last couple months, and both of them feeling absolutely incredible. So if you've been thinking about it, LDS Hospital, the place to contact.
Life-changing stuff, actually, yeah. All right, you guys.